Today's video is about OET speaking. So, if you're preparing for the OET speaking subtest, especially for the nursing role play, then today's video is going to be a gold mine for you. I'm going to walk you through some real life scenarios that could come up in your OET speaking test. So, I'll give you the kind of responses examiners love, and most importantly, I'll break down exactly why these responses work. So you're not just memorizing answers, you're actually learning how to think like a confident OET candidate. Remember, in the OET speaking role play, it's not about speaking fast or using big medical words. It's about sounding natural, empathetic, and professional while still showing you can give clear, patient friendly explanations. Got it? Let's jump right into the scenarios. Let's move on to the first scenario. Scenario is patient is worried about surgery, and the situation is the patient is anxious about their upcoming surgery and expresses fear about possible complications. How your response should be. I completely understand how you're feeling. It's normal to be nervous before any surgery. Let me reassure you, the surgical team here is very experienced and we follow strict safety protocols at every step. Your doctor will be with you from start to finish, and our nursing team will be monitoring you closely before, during, and after the procedure. We will also explain everything in simple terms before we start so you will know exactly what's going to happen. Is there any specific part of the surgery that you would like me to explain more clearly? See the response here. I'll tell you why this response will score you high. Because here you are showing empathy by acknowledging the patient feelings, right? Because you're telling, I completely understand how you're feeling. It's normal to be nervous before any surgery. And also here you're building trust by highlighting the safety and you're showing the expertise of the team. And we are using very simple, non technical language. And most importantly, we are inviting the patient to share more concerns. That means it shows interactive communication, right? Which is a very important key in OET criteria. Let's move on to our second scenario. So here, patient refuses medication. That's the scenario. And the role play situation is the patient refuses to take their prescribed medication. In this scenario, how will you respond? I understand that you might have concerns about taking this medication. Could you share with me what's worrying you the most? Is it the side effects, the dosage, or something else? Once I know more, I can give you accurate information about why this medication is important for your recovery. And we can also discuss any alternative options your doctor might approve. Your comfort and safety are our top priority. So, this response gives you higher score because here you're opening the conversation with curiosity, not with judgment. And we are using open ended questions in order to find the reason for the refusal. And also, we are balancing patient autonomy with medical guidance. And most importantly, here we are demonstrating a patient centered approach which OET examiners look for. Got it? Okay, let's move on to the next situation. The scenario here is patient is in pain after treatment, and the role play situation is the patient complains of pain after a recent procedure. In this case, how you need to respond. I'm sorry to hear you're experiencing discomfort. On a scale of 0 to 10, how would you rate your pain right now? This will help me decide how best to manage it for you. We have different options from adjusting your medication to changing your position or using cold or warm compressors. I will also inform your doctor immediately so we can address this together. Let's make sure you're feeling more comfortable soon. Let me tell you why this response works. Here, we are showing empathy and we are also listening actively, right? We have started like, I'm sorry to hear you're experiencing discomfort. right? And we are asking for a pain scale. If you see here 0 to 10, how would you rate your pain right now? So, which shows a clear clinical step. And also, we are offering immediate and specific solution such as adjusting medications to changing position or using cold or warm compresses. Got it? And also, here we are showing our teamwork with the doctor, which portrays the professionalism. Got it? Okay. And the next scenario is patient worried about lifestyle changes. So the role play situation here is the patient is concerned about changing their diet and exercise after a recent diagnosis. So here is our response. I understand that making lifestyle changes can feel overwhelming, especially when it affects things you have been used to do for a long time. The good news is you don't have to make all the changes at once. We can take small, manageable steps. For example, adding more vegetables to your meals this week and then gradually increasing your physical activity. I can also connect you with a dietitian and physiotherapist who will create a plan suited to your needs and preferences. How does that sound to you? So, in this response, we are breaking down change into small and manageable steps by adding more vegetables first and then gradually increasing the physical activity, which is very achievable thing, right? And then we are encouraging the patient involvement in planning, because here we have mentioned I can also connect you with a dietitian and physiotherapist who will create a plan suited to your needs. That means their preferences also matters, isn't it? And we are showing a collaborative and a supportive tone, and also we are demonstrating the problem solving skills. Got it? Now remember, in order to score more in OET speaking, especially for this nurse role play, first you need to show the empathy. You have to always acknowledge emotions before giving information. And then you have to explain clearly. Try to avoid medical jargon unless you also explain it in simple words. Okay, you have to structure your talk. First, you have to start with the problem. Then, you have to provide the reassurance. Then, you will move on to the solution. Finally, you should make sure whether the patient understand what you're saying or not. And when you're checking understanding, you can use phrases like, does that make sense? Or would you like me to explain again? Would you like me to explain more? By telling these phrases, you are giving place for the patient. You are inviting the patient into your conversation. Got it? You're using open ended questions. And try to use a natural tone, not robotic, not too casual. And I'll tell you, there are some of the responses which will score low. Let me tell you. The first one here is an example for scenario surgery pain. If you're telling, if the patient is complaining about the surgery pain, don't worry, we will give you medicine for pain. No, it is too short and you're not showing any empathy, no detail, and it sounds dismissive. Okay, don't do that. Another example here, waiting time. If the patient needs to wait for a long time, and if you're going and telling, we are busy now, you have to wait, no, because this will not give you a higher score. You're not saying any apology, no empathy, and it does not offer any support. Patient might feel ignored. Got it? And this is another scenario for medication. If the patient is asking any doubts regarding the medication, and if you're telling, side effects are rare, just take it. No, don't say in that way, because you're dismissing the patient's fear and you're not giving proper explanation, and you sound so much authoritarian. So never do that. Okay? So these are some of the tips and tricks in order to score more in OET speaking, especially in nurse roleplay. That's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.